Welcome back to part 2 as we continue to take a look into the many programs at the University of the West Indies Cayville campus's Faculty of Medical Sciences at Cayville, Barbados. A healthcare system is an organization of people, institutions, and resources to deliver healthcare services to meet the health needs of a target population. That is why getting students ready for the world of work is a very important component to the faculty's success.
My name is Dr. Roger Seeley, and I would like to welcome you to the University of the West Indies Cayville campus. I'm welcoming you in the capacity of the program coordinator for a wonderful program called the Bachelor of Health Sciences. The Bachelor of Health Sciences was started in 2015, and the express purpose of this program was to train professionals who can work within Barbados, within the Caribbean, and also internationally in health systems, and to strengthen the health systems. A person who goes through our program and who's taught the necessary skills will be able to allocate the scarce resources that we have as a Caribbean peoples to make sure that polyclinics, hospitals, private clinics run as efficiently as they possibly can to make sure that we service our population. So again, I want to welcome you to be part of this team here in the Faculty of Medical Sciences, and more specifically the Bachelor of Health Sciences. As a young person, I am interested in your thoughts, your ideas, and I want to make your dreams a reality. Come, join us so that we can help you to do this. We accept you for who you are. We accept you for what you have to offer, because it is these ideas that are necessary to help to evolve the health system so that we continue to do the best that we can do for our population. Again, I thank you, and I really look forward to seeing you next academic year.
We turn now to Matthew. His journey with illness has been a long and difficult one, but with the care of doctors and nurses, he's been able to appreciate the optimum care that we all enjoy in Barbados.
They discovered this early, thanks to the doctors, because as I said, I thought it was a strain, a spasm in my back, but the doctors took the time to really examine me the way they should, and they discovered that it was multiple myeloma, and fortunately they discovered it in the early stages, because it is apparent that, or apparently they say, that sometimes this particular cancer isn't diagnosed until it might be too late. Fortunately for me, the doctors took time and to put in the effort, and it was discovered in the early stages. My name is Matthew Reese. Most people call me Reese. No, I used to play cricket, but due to my illness and stuff, I can't anymore. How to put this? For me, it's tough. You know, I love the game, and to find out that I can't actually play cricket again, can't run, can't take too hard of a knock on my any parts of the body or stuff, you know, it's hard. So it's just for me to watch cricket and reminisce, I guess you could say. Based on my research, they tell me the expectancy is around 5 years or so. Some people, yes, with treatment and stuff, can live a lot longer because there is no cure for this. 2nd August 2018 will be 4 years I was diagnosed with multiple myeloma, and you know, I try to be as positive as I can. We don't know what's going to happen from one day to the next, and for me, that being diagnosed with cancer just like that was an eye-opener. You know, not thinking about anything like that, and just one day I can't get out of my bed, can't walk properly, having to use the cane and all that. And it dawned, well, Matthew, you're not a Superman, you know.
Public health delivery systems exhibit important structural differences that may influence their operations and outcomes. Due to the COVID pandemic, public health has undergone a notable resurgence in visibility among both policymakers and the public at large.
Hello, my name is Dr. Natalie Graves, and I lecture in public health here at the University of the West Indies Cayville campus in Barbados. I also coordinate the MPhil PhD program in public health. And today, I'm just simply delighted to chat with you, encourage you, and welcome you to our Cave Hill campus. If you are a person who really wants to make a difference in healthcare, not only in our region, but internationally, if you are concerned about the health and disease states as well as our health system, then UWI Cave Hill is the place to be. We have ongoing international collaborations that are actively making a difference in the way in which healthcare is delivered in our region and around the world. So look no further. Think about our MPhil PhD program in public health and epidemiology here at the UWI Cave Hill. So once again, I encourage you and I welcome you. Come be a light arising out of the West.
Caribbean people have become susceptible to obesity and its negative influences. The many cultural attributions such as poor diet, lack of discipline for exercise, and lack of nutritional education has caused much concern within the medical community.
Hello, my name is Michelle Carrington, Program Coordinator for the Human Nutrition and Dietetics Program at the University of the West Indies, Cave Hill campus. Nutrition-related health challenges are not new or uncommon to the Caribbean region. Throughout our history from slavery to post-emancipation, Barbados and the rest of the Caribbean have encountered several health conditions associated with malnutrition. And when I speak of malnutrition, I am referring to nutrition imbalance, both undernutrition and overnutrition. In the Caribbean, we have 60% of adult females and 20% males considered either overweight and obese. And I highlight obesity because obesity is a major predisposing factor for many other chronic diseases. Additionally, 24 to 27% of adults have hypertension, and for example, in Barbados, we are seeing the prevalence of diabetes in adults at 16.4%. These trends and data illustrate that a high percentage of persons living in the Caribbean have some type of non-communicable disease. These non-communicable diseases present significant implications. They threaten to rob us of our most valuable resource, our people. They threaten our population's growth and development. They also pose the risk of reversing our social and economic gains. Among the Caribbean's population of 44 million, there is a dearth of trained dietitians within the region. The diseases that we are faced with are all nutrition related. Therefore, it makes sense to have trained professionals to be on the front line to help manage these conditions. Our program aligns well with the Caribbean Accreditation Authority for Medicine and other health professions standards for nutrition. On completion of this training, graduates will be eligible to register as a dietitian with the Barbados Paramedical Council or an equivalent regional body. We provide an integrated, supervised professional practice experience in the clinical, community, and food service setting. Our program possesses a strong clinical research focus. We also employ varying teaching methods. We accept both full-time and part-time students. We have a balanced student enrollment with an optimal student-staff ratio, and it's quite cost-effective. So if you're interested in health and healthcare, you're able to motivate others and problem solve, you're passionate about nutrition, possess good communication and interpersonal skills, or you simply want to make a difference in the lives of our people, I invite you to enroll in this new helping profession, which will help pave the way for a healthier Caribbean.
There will always be something new to discover in pharmacology. This is a field that pushes healthcare forward, driven by our fundamental need to reduce suffering and extend the length and quality of our lives.
In 2015, after the Faculty of Medical Sciences had settled its efforts in establishing the full MBBS program, we decided that we wanted to dwell into the expansion of our basic medical science degree programs. And we thought that the best way that we could do this was to establish postgraduate training programs in these basic sciences. We developed a Master of Philosophy, Doctorate of Philosophy program in pharmacology. As a pharmacologist and with training at Mona, where I spent most of my time investigating the medicinal effects of plants, it was natural that this was our primary focus. Barbados, like a lot of Caribbean territories, have a rich biodiversity in our plants. And we wanted to explore this rich biodiversity and identify potentially new medicines that have not been discovered before that could potentially impact some of the severe conditions that impact our society. In that same year, I wrote a book called Medicinal Plants of Barbados, which was one of the first large archive source of data which identified these plants and their medicinal value. 6 years after that, we now have a program with 6 students who have occupied their time looking at and investigating a lot of these plants that are captured in that book, and also new plants which have been reported by people in society as having medicinal value. 3 of my students are quite keen on exploring cannabis and compounds from cannabis for medicinal effects, and the environment is enriched for that type of research at the moment, seeing that Barbados has passed legislation in 2019 which is actually looking at the development of a medicinal cannabis industry.
Hearing the stories of those impacted with some medical challenges and the significance the healthcare system has played in their journey to healing and recovery, it shows the importance of a well-structured healthcare medical system in any country. So join us and make your future with the University of the West Indies Faculty of Medical Sciences program. Why not contact us today? Email fms@kphil.uwi.edu or call us at 246-147-4694 or 426-147-4703 or 246-147-4264, or even fax us at 246-438-9170.